I wanted to say a few words about occlusion, and in particular, the way we treat it using orthotropics. I find dentistry a fascinating subject. Many people think the teeth are rather boring, but it's amazing how much you can find out about a patient's problems just by asking simple questions. I've just seen a young lad who was worried that his jaw on this side seemed to be getting a bit bigger. I thought, that's strange, things don't do that. So I asked him one very simple question. I said, just close your mouth and gently bite on your teeth and tell me if they all meet evenly. And he did that, and he said, no, there's slightly more pressure on this side. That immediately set my mind whirring. The teeth should always meet evenly if you bite them together, because those that aren't erupted enough will come down, and those that have erupted too far will intrude again. So there has to be a reason if ever some teeth aren't in contact. And so I looked in his mouth, and on the side of his tongue I could see indents all the way down the side, caused by the marks of the teeth on the edge of the tongue. This is a very classic sign of someone who sucks on their teeth when they swallow. And of course this has an effect in the long term on the way the teeth meet, because when you suck on the top and bottom teeth, the tongue pushes between them slightly. As you know, a correct swallow is with the tongue on the palate and hardly touching the teeth at all. And so it was quite easy to diagnose this kid's problem. All he needs to do is learn to keep his mouth shut and keep his tongue gently up on his palate, particularly remembering to do so when he swallows.